everyone. Today our class is about brachial plexus. And today we are going to discuss about the brachial plexus and its clinical anatomy along with the mnemonics and some shortcuts. Okay, now coming to the point. Today our class is about this brachial plexus. I will write here brachial plexus. Brachial plexus. This is the class of today's topics. Share the video with your friends and classmates. Subscribe to our channel. Okay, now coming to the point. While studying in the brachial plexus, see, brachial plexus is subdivided into 5 parts. It is subdivided into 5 parts. That is roots. See here for it there is a mnemonic. Already it is in the textbook. Ramu Taylor drinks cold beer. Ramu Taylor drinks cold beer. This is the mnemonic. It is also already given in the textbook. This is the mnemonic. Today we are going to discuss about. This is the parts that belongs to this brachial plexus. So to remember this, see, let's make a tree of brachial plexus. This is the tree of brachial plexus. Okay, at the trees, these are the roots. A tree, these are the roots of the brachial plexus, and it is the trunk of the brachial plexus, and these are the divisions. Okay, these are the divisions of this brachial plexus, and from the division we are having cords. From the division we are having cords like this. From the cords we are having branches. From each cord we are having branches. So this is the order how we have to study in the brachial plexus. See, from roots to trunk, and then from trunk to division, and from division to cords, and then cords to branches. Okay, this is how we have to study in this rule. And now coming to the roots. Okay, it is the mnemonic of this, about to remember this one. And now coming to the roots of the brachial plexus. Roots of the brachial plexus. See, there we have 5 roots. See, this is your finger having 5 roots, C5 to T1, C5, C6, C7, C8 and T1. Okay, C5, C6, C7, C8 and T1. These are the 5 main roots that are included in the brachial plexus, and some occasionally we can see C4 and T2. If the C4 is present, T2 may be absent. In the condition, if the C4 is present, in that condition T2 may be absent or it is less present. Okay, if in the condition, if the T2 is present, C5 may be present or maybe may be absent or maybe lightly present. Okay, these are the roots. See, roots, we have 5 types of roots. Now coming to the point. See, I will write here, we will write here C5, C6, C7, C8 and T1. These are the roots. See, these are roots. From the roots we are getting, from C5 and C6 it forms, joining of C5 and C6 it forms upper trunk. Joining of C5 and C6 forms upper trunk, and C7 alone forms middle trunk. C7 alone forms middle trunk, and joining of C8 and T1, roots joining of C8 and T1 forms lower trunk. See, joining of C5 and C6 forms upper trunk, C7 forms middle trunk, and C8 and T1 forms lower trunk. Okay, See each trunk, see these are three trunks, each trunk is subdivided into two parts, ventral part and dorsal. Okay, see it is subdivided into two, each trunk subdivided into two, one is ventral, up one, and lower one is dorsal. Upper one is ventral and lower one is dorsal. So watch clearly. From the ventral, I mean see from upper trunk and middle trunk, ventral divisions of upper and middle trunk forms lateral cord. Okay, ventral divisions of upper and middle trunk forms lateral cords, and lower ventral division of lower trunk forms medial cord. Ventral division of lower trunk forms medial trunk, and all the dorsal divisions of three trunks, that means upper trunk, middle trunk and lower trunk, all the three divisions of dorsal divisions forms posterior cord. Okay, all these three forms posterior cord. Okay, now coming to the point, in this lateral cord, see now coming to the point, this lateral cord forms lateral pectoral nerve. It gives it supplies to the lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. Lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. These three are supplied by C5 to C7. C5 to C7. Okay, these three are supplied by the roots C5 to C7. Okay, now coming to the middle trunk. Middle trunk supplies to the medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve, and ulnar nerve. See, it forms five. It gives this medial cord gives to subdivides into five branches of nerves. First one is medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and the medial root of median nerve, and ulnar nerve. Next, while coming to the posterior cord, these posterior cord gives to 4-5 branches. The mnemonic of it is ultra, ULTRA. These are the 5 nerves that includes in the posterior cord, and that is upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve, radial nerve, axillary nerve. Upper subscapular nerve, lower subscapular nerve, thoracodorsal nerve, radial nerve, and axillary nerve. These are the five nerves that arises from the posterior cord. Okay, and these four nerves, that is, they starts with letter M. These 4 nerves are supplied by C8 and T1 roots, and this ulnar nerve is supplied by C7, C8 and T1. C7, C8 and T1. Next, coming to the point, these U and L is supplied by C5 and C6. This T is supplied by C6, C7 and C8. These R, radial nerve, is supplied by C6 and T1. This axillary nerve is supplied by C5 and C6. Okay, I will provide all the shortcuts in the notes. These are the nerves that comes from the medial cord, lateral cord, and posterior cord. Okay, now coming to these. Now coming to the roots. See, this C5 and C5 to C7. That means I will draw with the blue ink. C5, C6 and C7. These three roots supplies to the serratus anterior muscle. These three roots supplies to the serratus anterior muscle, and this C5 supplies to the rhomboid muscles. That means both rhomboid major and rhomboid minor. This C5 supplied to the rhomboid muscles. C5, C6 and C7 supplies to the serratus anterior muscle, and C5 to C8 I will draw with this red. C5, C6, C7 and C8. These four nerves, these four roots supplies to the longus colli and scalene muscles. Longus colli and scalene muscles. Longus colli and scalene muscles. Okay, I repeat again. C5 supplies to the rhomboid muscles. C5, C6 and C7 supplies to the serratus anterior. C5, C6, C7 and C8. These four roots supplies to the longus colli and scalene muscles. These are all about the brachial plexus. This is the topic of the brachial plexus. I will provide all the notes that is useful for the examination, and all the shortcuts also I will provide in the Instagram. And now coming to the clinical anatomy of the brachial plexus. See, clinical anatomy, we are I will write here clinical anatomy. In the clinical anatomy, we will discuss about the two important clinical anatomies here. First one is Erb's paralysis, ERB' paralysis, and second one is Klumpke's paralysis. Klumpke's paralysis. See, Erb's paralysis and Klumpke's paralysis. We will discuss it by comparing each. Okay, first one is site of injury. Site of injury. First point what we have to discuss is about site of injury. In the site of injury, Erb's paralysis is caused because of injury at Erb's point. See, Erb's point is one region of upper trunk of brachial plexus. Okay, it is one of the reason from the upper trunk of brachial plexus. So Erb's paralysis is caused by the injury of upper trunk of brachial plexus. Okay, next we are coming to the Klumpke's. This it is injury. See, Klumpke's paralysis is caused due to injury at lower trunk. It is at the injury of upper trunk, and Klumpke's is due to the injury of lower trunk. Okay, this is the site of injury. It is due to the upper trunk injury. It is due to the lower trunk injury. This is the site of injury. Now coming to the causes of injury. Causes of injury. That means what it caused because of the injury. See, it is caused by Erb's paralysis. That means upper trunk. The injury of upper trunk is caused by maybe because of birth injuries or difficulty in childbirth. Birth injury or difficulty in childbirth, or maybe fall on shoulder joint, or maybe during anesthesia. See, if we apply anesthesia to the patient, he will get Erb's paralysis at the time how much the anesthesia is in his body. Okay, during anesthesia condition. Okay, it is the cause of injury of Klumpke's disorder is due to undue abduction of arm. That means more over abduction of arm. Next, maybe due to clumping something with hands after fall from height. Okay, clutching. See, clutching something with hand after falling from height, or maybe due to sometimes in birth injury also. So birth injury is included in both Erb's paralysis as well as in the Klumpke's paralysis. These are the causes of these clinical anatomy of Erb's paralysis as well as the Klumpke's paralysis. Are now coming to the nerve roots injured. Nerve roots injured. Roots injured. In the roots, see in here maybe C5 or C6 injured. See, C5 is mainly injured. Mainly it is because of mainly injury in C5 and sometimes injury of C6 also. So it is it is due to mainly injury of T1 and sometimes C8. Mainly due to T1 and sometimes partially C8. This is the nerve roots that is injured because of this that is injured. Next coming to the muscles paralyzed. Next coming to the muscles that are paralyzed in this condition. See, in this condition mainly biceps brachii, deltoid muscle, brachialis, brachioradialis. See, it is because of maybe say these muscles are mainly paralyzed due to abs paralysis, that is biceps brachii, deltoid muscle, brachialis, brachioradialis, and sometimes partially supinatus, supraspinatus, infraspinatus, supinator muscle. These muscles are also paralyzed because of this condition. Now coming to the clump case. See, in the clump case, here intrinsic muscles of hands are mainly paralyzed due to these conditions. In this condition, intrinsic muscles of hand is mainly paralyzed. This condition is because of T1 and ulnar flexus of wrist and fingers also paralyzed because of injury in root C8. Okay, intrinsic muscles is because of T1 and ulnar flexus of wrist and fingers is because of C8. These are the conditions that are these are the muscles that are paralyzed because of abs and clump case. And now coming to the deformities of position and limb. Deformities and position of limb. Okay, deformities. And now coming to the abs paralysis. In the arm, hands are side by side like this. Okay, in the hands are side by side. I will provide the picture in Instagram, and it is adducted and medially rotated. And while coming to the forearm, see, forearm is extended and pronated. Okay, these deformity is called as policeman's tip hand or waiter's tip hand or porter's tip hand Okay, now coming to the deformities of clump case paralysis, it causes claw hand, and it causes claw hand. Okay, it causes hands by side. Okay, it causes claw hand. These are the deformities of these two paralysis. And now coming to the last point, disability of abs, disability of abs paralysis as well as clump case paralysis. Now coming to these studies, see, in the abs paralysis, abduction and lateral rotation of arm of shoulder joint is affected. Next, flexion and supination of forearm is affected. Biceps and supinator jerks are lost. And the sensations are lost over small area or the lower part of deltoid muscle. Okay, at the small area of deltoid muscle, the sensation is lost. Okay, there is a loss of sensation. These are the disabilities of this abs point. Now coming to the clump case point, the disabilities causes complete claw hand, and next cutaneous anesthesia and analgesia is a narrow zone along the ulnar border of forearm of hand. Next, Horner syndrome. In the Horner syndrome, the eyebrows of one eye is affected. The eyebrows are affected, and it seems some like carry bags or something. It is called Horner syndrome. I will provide the picture in Instagram. And in the Horner syndrome, it is because of the injury of T1 root. Horner syndrome is mainly because of the injury of root T1. Next, coming to the vasomotor changes. Next point is vasomotor changes. In this condition, the skin area with sense is lost. See, loss of sense to the skin. This vasomotor area damage causes loss of sense to the skin. Okay, next point is tropical changes. Next one is tropical changes. See, it is caused because of, if the paralysis occurs for a long time, or if the paralysis condition is for a long time, the skin becomes dry and scaly See, I will wiping these. Tropic change. See, tropic change means if the paralysis, if the condition of paralysis is for a long time, the skin gets dry and scaly. This is called tropic changes. This is all about the clinical anatomy of these brachial plexus, that is abs paralysis and Klumpke's paralysis. This is all for today. We will meet tomorrow. Thank you all.